Top 10 questions asked by my patients. I'm Andrew Campbell, and I specialize in facial rejuvenation surgery. So all I do are eyelids and facelifts, deep plane, some endoscopic brow lifts, fat grafting, laser resurfacing, basically anything that I need to do to be able to take someone and make them look the way that they used to, which is really the way they think they look inside their head, and now I make them match. The key is very natural results. I've talked about that for literally 25 years. I don't want anybody ever to walk out of my office not looking like 100% them, so that other people that see them don't even think they ever had anything done. It just looks like them, but 20 years ago. So what are the top 10 questions? Number 10, at what age should I consider a facelift? And the answer is, if you're considering a facelift, you're at the right age. And the reason I say it that way is I have done deep plane facelifts on anybody from 31 years old to 86 years old. Seems like 31 is young until that 31-year-old does this and you go, wow, you look a lot better. And it is very genetic, it's very hereditary. So I always say, if you see something you don't like, why are you waiting? The number one complaint we get by far is, I wish I would have done this sooner. The 50-year-old that waited until they were 50, but they really didn't like their jawline or their neck when they were 45, just spent 5 years of their lives not liking the way that they look, not feeling comfortable and confident until they got their procedure done when they were 50. Why didn't they just do it when they were 45? They would have had 5 years of confidence and beauty. Number 9 is, how do I choose the right surgeon for my facelift surgery? The best way to find a great surgeon for facelift surgery is to find people that they've had treated. I actually think hairstylists are great resources because they see patients and they're doing their hair and they're shampooing back behind their ears. They see these facelift scars. They see their patients a lot of times for decades, and they'll see them go through the process. I can tell you I have had countless referrals from hairstylists because of the fact that they see my results and the scars that my patients have, and they like them. A second way to find a great facelift surgeon is just simply by experience. I am a better facelift surgeon than I was 25 years ago. I'm going to tell you I'm a better facelift surgeon today than I was even 10 years ago. It takes a very, very long time. I was a good facelift surgeon 25 years ago. I really was. And I gave people very good results. Good and great are slightly different. People are happy when they get a good result. They're ecstatic when they get a great result. And I think it's from experience and specialization. So all I do is aging face surgery. I would always recommend somebody see somebody that truly specializes in aging face surgery if that's what they're interested in. Number 8, can I just get a neck lift? Because that's the only thing that bothers me. The answer is maybe. If somebody were 40 years old and their neck bothered them and they really didn't have a lot of laxity, I couldn't grab a lot here, I lift here, it doesn't really change very much, I can just do a neck lift. We go in through here, we do some liposuction, I do a platysmoplasty, work on the subplatysmal muscle or the subplatysmal fat and contour it, and then you just let the skin kind of reflect on its own. We place a pressure dressing and they can get away with that. I'm going to guess it's 2% of my patients. Maybe it's even 1%, because the far majority of them, if I were just to do that, there's no place for the skin to go because they've got all this extra skin. That's why they're complaining about their neck. Only way I'm going to get rid of that skin and make it look natural and good is to do a deep plane technique on the sides. So whether that's an in-office mini lift or a full deep plane facelift, it goes in conjunction with the neck lift. Typically, when somebody comes in wanting their neck done, we're going to end up doing a lower facelift, which again is either a mini neck or a full deep plane with a deep neck lift. Number 7, kind of related to number 8, will a facelift tighten my neck as well? The answer is yes. No matter what type of quote facelift you're going to get, it is going to tighten your neck. So I do see people that are younger, let's say they're in their 30s or even into their 40s. If I do this and they look absolutely perfect, I may give them the option of just doing either a mini lift or a deep plane facelift in the operating room and no neck lift. They would have to have pretty minimal neck problems for me to recommend that, because what ends up happening if we just do the part on the sides, the mini or the deep plane, 5 to 7 years later, they're probably going to be complaining about their neck because it's going to become lax and it's going to start to sag and they're going to have those little platysmal bands. If we did the neck lift at the same time, 5 to 7 years later, their neck's still gonna look great. Even patients that have minimal banding and say they're in their 50s, I'll tell them we could just do the sides, but this is gonna come back in 5 to 7 years. So I still give them the option, even though I could make them look great with just this, they may wanna do the neck for longevity. Yes, I can make a neck look great without doing a neck lift, but I can't make it look great for 10 plus years without doing the neck lift. So most of my patients choose to do both. Number 6, will I look like I had a facelift? And will my mouth look different? They go hand in hand, because usually the reason people look like they had a facelift is because their mouth got pulled. Now they've got this funny looking, too wide of a mouth. There's lots of movie stars that have gone through this period. Over time, it tends to get better because it relaxes. Some people look like they've had a facelift because it was their second facelift, and they did a standard approach, not a deep plane, and they've swept them, where the lower face is tight, the mid face is not, and now they've got this weird, especially if they lean forward, you can kind of see these little bands and things, so they look like they've had a facelift. The answer is, if you see the right surgeon with experience, you can get a facelift, even if it's your second or third, and still get a fantastic, natural looking result. And I personally believe it has everything to do with the deep plane technique. When you go under the smaz layer, when you release it completely, and that's the key. You can't just go under it, you've got to release it, because if you don't release it, you haven't really accomplished anything. But releasing it allows us to lift more vertically, which is against the direction of aging, and we're able to lift the mid-face with it. So the far majority of my patients get so much mid-face lift that I have to come up here and do a little extension to get rid of this bunching, which we want, because we want that cheek to come up. That's kind of like what Lindsay Lohan had. You want that natural look, and you want that elevation as a whole, so that ultimately you don't look like you had a facelift. So number 5, am I gonna have visible scars when we're done? And the answer is yes. Everybody has visible scars from a facelift. The question is, does anybody notice them? And can anybody actually really see them? Because when we hide them in areas that we expect to see a line, such as the crease that's right in front of an earlobe, almost everybody has a crease right there. Well, if I put a scar there, it looks like the crease. So can you really see the scar? Not really, it looks like a crease. When it's behind the cartilage, you really can't see it. When it's behind your ear, you can't see it. When I go along the hair, I bevel it so that hair grows in the scar. It's not easy to see. Now, everybody heals differently. Some people heal extremely well, and I would say half my patients heal extremely well. Once those scars mature, honestly, you could look for them even if you knew where to look, and you'd have trouble saying that was a scar. The other half heal well, but not quite as good, and if you knew what to look for, could you see a scar somewhere? Yeah. But they're hidden in areas where if you aren't looking for it, your brain would never see it. It's like hiding a line in the corner of a room. Nobody would see it because you expect to see a line in the corner of a room. It's a matter of camouflage and taking tension away from the closure. So like the deep plane technique that I do, all the tension of the lift is on the deep plane, very little is on the skin. When you close skin under very little tension, you can make very small, fine scars. If you try to pull on skin to get a better result, which what a lot of people that don't do a deep plane tend to do, and that's why patients look kind of pulled and done, then you end up with a tension on the closure that tends to widen the scars look worse. So there's things that we can do to make people have very inconspicuous scars, but anytime you cut skin, by definition, you're going to have a scar. It's let's make it as inconspicuous and basically as invisible as we possibly can. Number 4, how long is it going to take me to recover from a facelift? I have heard some pretty horror stories from people, especially that had it done, say, 30 years ago or more, where they had 6 to 8 weeks where they couldn't go out and see anybody. And I always question, like, what were they doing in there beating this patient up? Because for the most part, if it's just a facelift, most of my patients are back in 1 week. Doing the deep plane technique, you're not directly under the skin, you're under the deeper layer. You tend not to bruise as much. So the bruising usually is minimal and it goes away faster because of that. And by a week, most of that's gone. You don't get that much swelling from a facelift, and the incisions look pretty decent at a week. So most of my patients, a little bit of cover makeup, and it's about 1 week. For younger patients, I may do what we call a mini lift, where it's just a deep plane style lift in the office on the sides. We don't do anything in the neck. 95% of those patients don't even bruise. Their stitches are in and around their ears, but the rest of their face looks great, and the area of injury is quite small after we do all this lift. I've had patients go to work the next day. Now that's unusual. Most people don't want to go to work with stitches in, but it can be done. Most of them wait that week until the stitches are out. A lot of them will wear their hair over their ears and still do some normal things even when their stitches are in that first 7 days, which is kind of amazing. But with that technique and with the limited amount of injury once all the lift is done, because I'm lifting from way down here and it closes up to a very small area, recovery can be incredibly quick. But max on a facelift, probably 10 days. If somebody had a hematoma, they bruise more, maybe a little bit of swelling on that side, that takes maybe 10 days, but certainly by 2 weeks, everybody's back doing normal things. Number 3, how much pain am I going to be in? Not as much as I think you will be. People always think this is your face, it's all sensitive, you're gonna have all this discomfort, it's gonna be an agony. And the answer is, little tiny nerves are cut. So like a lot of this area ends up being numb temporarily. And when I say temporarily, it's for months. I mean, 3 to 6 months in most people. So just from that, you really don't have any sensation on the surface. It's really not that uncomfortable. All the lift and the tension is done on the deep layer. And that's the muscle layer that's very fibrous. So there's not a lot of sensitivity in that. And then at the end, we put a pressure dressing on, which adds to that tightness and pressure. Almost everybody I've ever done a facelift on has described it as a pressure or tightness, not so much like a sharp pain. Most of them, yeah, I'll still say most of them take a pain pill the first day, maybe into the second, but by the time we get that dressing off, it actually gives them a fair amount of relief, and the far majority of my patients are not taking any pain medication after that first day. Overall, relatively painless. It's uncomfortable the first day, but very few people would ever call a facelift painful. So number 2, how long is this facelift result gonna last? Well, that really depends on how aggressive that person's going to age in the future. I describe this like a boat on a river, and that's the aging process. I get to take the boat out of the river and I bring it way upstream, but I gotta put it back in the river and it's gonna float back down again. The further up the river I can take it, the longer it's going to take to get back where they started. That's one of the reasons I do a deep plane technique, because when we release the deep plane, I can lift it more and in a better direction. So not only do they get a better result, they get a longer lasting result. And because it's in the direction of aging and not having to be pulled back, they get a more natural result. How long is it going to last? I don't know what they're going to look like 20 years from now, but I've certainly seen my own patients 20 years later, and some of them look incredibly good, surprisingly good. I've also seen people back at 10 years and they have a little bit of recurrence. I've never seen anybody come back that was back where they started within 10 years. So I just tell people you're going to get at least 10 years out of a facelift. In the far majority of my patients, it's going to be much, much longer than that. Number 1 question, how much is this going to cost? Not too much of a surprise to be number 1, but facelift prices vary dramatically. They can be as low as in $7,000 and as high as $500,000. I know that sounds extreme for a range, but that is the truth. I would say on average, it's somewhere in the $15,000 to $20,000 range, but everybody's different. I feel like the more experienced surgeons that have extremely natural results, they're very consistent because they've done thousands of these, are charging more than the surgeon that may do these on an occasional basis, or the younger surgeon that's trying to build a practice. Getting into price ranges of the $20,000 to $100,000 range, if you're talking about a whole facelift, is not unusual, but every surgeon is different and every patient's different. So every surgery is highly customized for each individual's concerns as well as each individual's anatomy. I will tell them what is best. Sometimes they will tell me we can't go that far, so I will give them the good treatment instead of the best. But they're super happy with whatever we choose. I would just recommend seeing the best possible surgeon that you can afford, because obviously this is your face. This is who you would identify with. And if you're ever going to spend a little bit of extra on something, I would suggest it would be your face. If you have any questions, please leave comments below and please subscribe to my channel. And that's the facts on faces.